There's a mental health crisis on the horizon for the Black community, according to our guest expert today. And he says that this crisis will be worse for Black men and boys. Hi, I'm Veronica Rickert, and this is Badger Talks. And today we're talking with Alvin Thomas. Dr. Thomas is an assistant professor in the Human Development and Family Studies Department in the School of Human Ecology, and he's also director of the Ethnic Youth and Resilience Lab at UW-Madison. Dr. Thomas, thank you so much for joining us.
Well, thank you very much for having me here.
Dr. Thomas, you say that there is a coming mental health crisis for Black men and for boys right now at this particular moment in history. Why Black men and boys in particular?
That would be because they're in highest impact zones for coronavirus and for police killings. And because of the significant stigma against psychological services for that population and the need for reform in how providers engage and serve this population.
And in terms of mental health challenges, what particular challenges do you see for getting these populations the help that they're going to need?
Well, Black men and boys are more likely to be misdiagnosed and less likely to receive the appropriate level of care, even when they seek services. The additional effects of hypermasculinity make this doubly challenging for this population. Black men and boys continue to be denied their tears and their emotions. In my Ethnic Youth Resilience Lab, we address the need to change the conversation around mental health for Black men and boys and normalize the discourse around emotions, vulnerability, and mental health.
So in terms of normalizing these emotions and making room and responding with compassion and humanity, in general, you say these are things that haven't really been done before. So what do we need to do? What does need to change so that we do this right this time?
So if you're asking from a policy standpoint, what needs to change, our policies need to recognize the common humanity of Black people and treat them as human first. The law and order approach reinforces historical inequities that deny people that common humanity. I think Milwaukee and some other cities have already declared racism as a public health issue. That's a first step. Infusing resources into poorer communities and Black communities and increasing access to care will be a second step. Institutional change always seems difficult, but it is necessary. Policymakers must support the conversation and act decisively to prepare for the coming mental health crisis. But this historical cancer will not be cured overnight.
Are you optimistic that we can do this, that we can meet this challenge as it arises at this moment in time?
I think we can. I am optimistic. I think to lose optimism is to lose faith in humanity. I have seen small acts and large acts, people stepping in and helping neighbors, shopping for the elderly, going out and celebrating first birthdays and 99th birthdays with strangers while social distancing. These small acts, even the acts of protest, suggest to me that humanity is still alive and well.
And as we wrap up, what resources would you like to share with people who may be needing help at this point in time?
So first, know that these feelings are normal reactions to what you are experiencing, and that some people may need help growing through these experiences. So seek help. Subscribe to online resources like Urban Triage, blackmentalhealthresources.net, and of course, my Facebook Live weekly Black Males Mental Health Support Group. Speak with your pastor, your medical doctor, and elders in your community about how they can help you process these issues and potentially refer you to appropriate services. The Center for Popular Democracy provides information about organizations in each state that are helping to change society. Volunteer with local organizations in your state. Register to vote and complete the census. These are ways to make sure that you have a voice in what's happening around you and to cause change in your society.
Dr. Thomas, thank you so much for joining us today.
Thank you very much for the opportunity.
For more information, you can go to covid19.impact.wisc.edu, or you can email us at covid19update@uc.wisc.edu. This is Badger Talks.